Hello, we want to welcome everybody to Navigation Series Heart Failure Project Planning. Gone ahead and recorded this for everybody that has enrolled, and you can do this at your convenience whenever you have time to do so. Please do so prior to engaging in the rest of the series. We want to start off with a question. What would you like for the end outcome to be of the Heart Failure Initiative? We'd like for you to take a second to think about that question and write down your answer. We'll give you a couple minutes to do so. Okay.
Well, let's introduce ourselves real quick. I'm Lori Galeotto. I'm the Population Health Specialist with Compass. And we've got Jennifer Sorensen, who's the lead on our navigation series. She's the Quality Improvement Advisor. So part of the navigation series for heart failure, one of the commitments when you're signing up to be part of this is that you will be gathering some data for us. And the data that we need to gather for the heart failure measure is are your patients with left ventricular systolic dysfunction on beta blockers? Are they appropriately prescribed that medication? The measure description that you would be able to use to pull this from your EHR talks about the percentage of patients aged 18 or older with a diagnosis of heart failure and a current or prior left ventricular ejection fraction of less than 40%, and who were prescribed beta blocker therapy either within a 12-month period or a 12-month period when seen in the outpatient setting or when they were discharged from the hospital. So this is kind of a complicated measure to pull from your EHR, and you certainly don't have to pull the measure for us from everybody in your practice. If you would like to just take a pilot study and maybe do some chart reviews and see how you're doing in terms of making sure the patients are being prescribed this medication, that would be perfectly appropriate. So we're putting up here just a little cheat sheet for you, just to make it easier to figure out this metric. It walks you through when you're looking at your patient who you know is diagnosed with heart failure. You want to make sure, obviously, they're an adult over 18, they have their diagnosis, and then that they have had a measurement of their ejection fraction. And I'm just going to throw in here, some people are very comfortable with this terminology and some people are not so much. So when you're talking about heart failure and a left ventricular ejection fraction, what you're talking about is the percentage of blood that gets pumped out with each heartbeat from the left ventricle. So that can be measured either from an echocardiogram or from an angiogram. So the normal amount of blood to pump out with each beat, you might think it's 100%, it's not, it's between 55–65%. So a patient who is only pumping out 40% or less blood from their ventricle is set up for heart failure and poor outcomes unless they're treated appropriately. So you want to just check and see if you have a documented ejection fraction and that it is less than 40%, or they might say on the echocardiogram instead that there's moderate to severe depressed left ventricular dysfunction, and that can count too if they don't actually put a number in there, but they have those words are similar to that. That would count as the patient qualifying to be in the denominator. And then the patient has to have seen the provider within 2 times within the last 12 months, or if it's a hospital discharge, we want to make sure the patient's being treated appropriately. So when you go through each of these questions under denominator, if you can answer yes to all of them, then you're going to include that patient in the data. If any of these categories you say no to, then this patient's not appropriate to be counted and you just move on. If they are appropriate, then you can look at your numerator. And when we're talking numerator, denominator, the denominator is the population of patients that are appropriate to look at for the data. The numerator is the number of patients that actually meet the metric that you're trying to achieve. So for the numerator to be included, they're going to have to be prescribed either the beta blocker, and you see here we have carvedilol, metoprolol, bisoprolol. Those are the three that would count in this measure. Or if they're not on any of those medications, then there needs to be a reason why. So maybe the patient has bad asthma and won't tolerate a beta blocker. Maybe they've had fluid overload and the beta blocker was held. So if there's a reason documented, then the patient still meets that metric. You've achieved that metric and you can count them. If they're not on the beta blocker and there's no reason documented, then they would not be counted. So I hope that makes sense to you. We're always here. If you need more guidance on this, we're here to help you, or you can ask your quality improvement advisor. They can certainly help you figure this out as well.
And we will have this form available on Healthcare Communities, and we will show you later on in our presentation where to find that on that website. So we're going to move ahead to the commitments. This is something that you guys have seen before, but we thought we would take some time to review them. As Compass PTN staff for QIAs and also for population health, we are committing to a step-by-step process for implementing the initiative. So that means we will be here every step of the way as you are going through your initiative and be a resource to you as you see fit. So anything that you have that comes up, please feel free to contact us. Our email addresses will be at the end of every slide presentation, and you can reach out directly to your own quality improvement advisor as well. Quality improvement coaching consultations during each project phase. That's just a little foreshadow of what we talked about previously. And the webinars are going to be led by experts in the field. We will have resources and toolkits available, which will also be held on Healthcare Communities, and we will show you how to navigate that later. And also, we're providing you with a network of participating clinics in order to bounce ideas off of each other and to feel supported as you go through these implementations. It's better to do things as a group rather than by yourself. Otherwise, it makes it very difficult to build off of success. As an enrolled clinic of the initiative, we would expect that you are going to identify an executive sponsor to support the initiative, assemble a team and identify a clinical champion to lead a successful completion of the phases, submit data related to the quality measure, complete surveys, share your successes and challenges, and attend all of the webinars. And you may be asking yourself, how am I going to build a team? What does that look like? So we have a video here for you to watch. We do have a couple of videos within this presentation where there might be a little bit of lag. We will have these saved separately so you can view them outside of the webinar as well, and I will show you where to find those within Healthcare Communities. So bear with us.
Do you want me to? So Sarah Pavelka, she is one of our faculty members. She is a quality improvement specialist. She'll be leading us through the building of teams and going through a plan, do, study, act cycle. She'll be the one that you see on the videos, and she's also a resource that we can reach out to for you when you're working on your projects.
Hello, everyone. I would like to welcome welcome you to a short presentation on how to create a team and setting priorities for that team. My name is Sarah Pavelka. I am a faculty member at the Iowa Healthcare Collaborative and Compass PTN. Excited to be here with you today and to talk about what we're doing and getting you guys started on working on process improvement teams. So a couple things that we're going to talk about. We're going to talk about defining the team, who all should be on a team, and this is really regarding a process improvement team. Also hints to help that team get started, and say you have lots of projects or lots of ideas for improvement, what could be some of those priorities and how do we select those? So let's go ahead and get started. First of all, let's talk a little bit about teams. There are some things that each team should think about, or we should think about as leaders when we start teams. And the first thing is, how much do leaders get involved? My short answer is leaders should get involved, but should not necessarily direct the answers that the teams come up with. So we'll talk more about that. We also need to talk about creating a culture of change. We wouldn't be here talking about process improvement and teams if we didn't want to or didn't need to change something within the organization. And it is really respected that we take that opportunity to change, and our culture and our leadership need to understand that that is what the focus is. It's not about blaming, not about pointing fingers. It's really about having an opportunity to improve for the sake of our patients. And then last but not least, we need to think about teamwork. This isn't about I or you, it's about we, and we really need to have a culture of teamwork and an understanding of what that means. So in a later presentation, you're going to hear information about clinical teams, and those are incredibly important, and a lot of these lessons that you'll learn in this presentation can apply for that as well too. But we need to think about having a culture of teamwork for our process improvement. So let's talk a little bit about teamwork and leadership behaviors with that. So first of all, what you see here on the slide is a list of some opportunities for maybe improvement when it comes to your leadership skills. But more importantly, it's when we talk about leaders and being involved and a good culture and related to teamwork, here is a short list of things that you can think about. Obviously, communication ranks right up there at the top of our list. But other things like respect and focus on process, empowerment, and examples, all these are critically important when we think about leadership being engaged with our team. So think about this, take some notes down from this, and have an opportunity to say, what am I doing as a leader within my organization that promotes the culture of change and great teamwork? So we've decided to have a process improvement team. What do we do next? Well, here is a list of some things that you can think about who all can be on that team. First of all, a good rule for the amount of people on the team are anywhere about 6 to 10. Doesn't have to be, quite 6 if you don't have that many people that are involved in a particular process, but think about keeping it really between that 6 and 10 range. If you have more than 10, it tends to get a little unruly, and you tend to have better facilitation skills. So about that sweet spot is about 6 to 10. Also, we need to have a team sponsor. That could be something like a senior leader in the organization, or someone that has a good deal of accountability or even authority. And we really want that individual to support, break down barriers, but they don't necessarily have to be in the team or involved every meeting. And so we have good communication to them, but again, don't necessarily have to be involved. We also have to have a good team leader. It's someone that is going to be involved in the team and really very good at listening. That's their job ultimately, is to do lots of listening. So think about having that individual and have an opportunity to be engaged in those meetings, but not necessarily doing a lot of the talking. Then we need to have process owners, individuals who are involved in doing the work, those that actually do the work. These individuals will be the ones that make the most decision. They are the ones that talk about what's working and what's not working, and what could work in the future. We also need support owners. These can be two individuals from other areas. Maybe it's IT or maybe maintenance, or could be a different department. They're really looking at it from an outside view, and they also could be great support moving forward with any ideas for improvement. We also need outsiders, someone who can really look in and be involved in the process, and this is a great way to involve your patients in this. And then last but not least, a facilitator. A facilitator is someone that knows the quality and process improvement tools, but not necessarily the process itself that you're trying to improve. So a couple tools for good teamwork. Code of cooperation or ground rules, laying the foundation for how we're going to behave. The P3T is a great tool to create a purpose statement. We need the why we're gathering a group of people together, so a great tool to invest in and take some time to say, why are we all here today? What's our purpose? And then the scope document. And a scope document can include an operational definition, maybe what's in, what's out. Again, restate the purpose, maybe have goals or objectives, timelines, those kind of things, and also include in that who's on the team. So we've decided to have a team. We've gathered our folks, but how do we decide what they're going to work on? Well, here's a way that you can help prioritize some projects. So the first thing is we want to think about strategy and mission, two incredibly important places to start. A couple quotes for you. The first one by Peter Drucker: keep in mind that culture eats strategy for lunch. So not only do we have to think about our strategy and mission, we may need to think about the culture, again, culture of change, culture of teamwork. But we also need to think about the no money, no mission. So again, we focus on mission, we focus on better value, better quality for our patients. But we also need to focus on what financial gains are we going to get from this kind of a team. So picking those priorities of improvements, they need to be strategically driven and aligned. In other words, they're going to help you meet the goals of the organization. They also need to be mission driven and aligned. So again, creating purpose for that team. How does it connect with the mission of your organization? So think about those two good places to start. Are we missing some sort of process or having misfires on a process that would strategically help us meet our goals? Or is it help us meet our mission? With that, I'll open it if you guys have any questions. I would like to say thank you for joining us today and spending a little bit of time. Just so you know, there's a way for future questions and follow-up. We are also going to have a longer 40-minute presentation on teams and how to select them if you would like more information, very similar. It just expanded on the information that we have today. So again, my name is Sarah Pavelka. Happy you could join us today. And if there's any questions, please feel free to contact us at the information below. Thank you, and hope you have a wonderful day.
Okay, so I want to thank Sarah for taking her time out of her day to do those videos. We also have longer versions of those on healthcare communities, along with these recorded videos as well. So as you heard, this is all about creating teams and creating teams for change. And so when we think about recruitment, we want to take the time to think about recruitment and who those people may be. So who would you want to recruit from your team? Why don't you think about that, write down your list, and then you can start putting your thoughts into action. I'll give you just a little bit of time here. Okay, so I'm just going to go through some of the some of the people I thought of when she was going through who teams could be composed of. So a clinician, pharmacist, nurse, health coach, clinic manager, quality specialist, data analyst, office manager, medical assistant. Of course, the list goes on, but a lot of those roles are fulfilled within your clinics. And so just kind of thinking outside of the little bubble that you may be functioning in on who else you would be able to bring in order to create change, because it only really takes a couple of really wonderful change agents in order to create some improvement. So we have another video by Sarah on how to use your data to create change. And once again, there is a little bit of a lag, so bear with us, and you can view this on healthcare communities separately as well. All right, I apologize. Having some problems with the video, so we're just going to go ahead and move on, and you guys can view that video later. So after you do view that video, we'd like to ask a question of how do you think using data will improve patient outcomes? So take a second to think about that, write it down, ponder that thought, let it marinate, and use that as your motivation moving forward. So I keep referencing healthcare communities. I have put a few slides together on how to get to healthcare communities, what you need to do in order to register and to be a part of your TCPI community, as well as a part of the Compass community online. So really, this is a platform in order for us to be able to share information, share calendars, and also so you can get the most up-to-date information straight from Compass. You'll be able to find all sorts of information on there, as well as be able to access national information from the TCPI network as well. So I am going to pull it up here in a second. Okay, so this is healthcare communities. I am already logged on. When you first come in, it's going to have an option up in the corner to either log in or to register. And so you'll just want to choose whichever option you're ready to do so. So this is what's going to come up when you are logged in. You will see that I'm a member of a few different ones here, but this is the TCPI one. This is from a national perspective as to everybody that participates in TCPI can access this and get any of the resources that CMS puts out for us. And then this one is the Compass one that we want you guys to go to. So when you are inside of the Compass community, you will see that there are all sorts of different things that you can click on in here. There's a calendar that has events. I am going to click on some stuff just so you can see. So there's a calendar here that has all of the different events as it populates for the month. And you can click on them. You can see what they look like. So see here, here's the one that you're on today. Hey, look. Target audience, physicians, clinical staff, improvement advisors, data analysts, and quality specialists, etc. And you can also click here to see more details. We won't today. But we are going to do some blogging on here as well. I know that Denise, our program specialist, was doing blogging for a while, but I know we ran into some issues with that, but it looks like she's back and running, doing it. So that's great to see. We do have documents listed here, which is actually where you will be able to find everything that we are talking about today. As I mentioned previously, I do have it on the slides as to how to get to them. So you don't have to remember everything I'm telling you, but I wanted to give you a visual. So on here, there's all sorts of different folders here. I'm just going to point out a couple of really excellent ones. So I do want to point out that there is coaching conversation. So if you do have health coaches, have them hook up with Lori Galeotto, and they can get some health coaching type of language in there to be able to bounce ideas off of each other. They're doing some threading within there. So I want to give a little shout out to the health coaches. We also have some PFE resources in here, and so anytime you're looking at patient and family engagement, you can always go straight here in order to get some resources. We'll be updating these as well because there is some old information, but some good information as well. So anyways, this is why we're here, Compass Navigation Series. Go ahead and click on that, and you will see that inside of there's a couple of different things. You either have your diabetes, because we also have a diabetes navigation series initiatives going on right now, as well as heart failure. We also will have a process improvement folder in here. The really great thing about this is that as we go through different education initiatives to address different metrics, we'll be adding folders. And within the folders, you'll find specific information to those initiatives, but something that's going to be key for every initiative moving forward is process improvement. And so we want to ensure that we give you the tools and we give you the resources to do that, and we have it all in one area, because those are so universal that you can you can use them across the board. I'm not even sure if we put anything in here yet, but this is the pathway that you'll find to look. Oh, look, we do have some stuff in there. So we do have the PDSA model along with the A3 and with the team charter. So you will be able to find the team videos, the short video along with the 45-minute video in here. Also, the data and change will be in here as well. Within heart failure, you will find our flyer that we have for just the series in general. We do have nursing contact hours approved for our next webinar, and so we'll go over that here in a minute. And so you'll be seeing the brochure in here, and later once we've uploaded it. And you'll also be able to see that we have a project planning, which is your webinar you're on today. Once we've recorded this, we will upload that webinar to this area. And you will see that we also have the measure itself in here. We have the quality measure worksheet, and we have the charter document. So any resources that you'll need will be right here. We're also going to put in like little, I don't necessarily want to call them homework assignments, but there's going to be things that you'll want to work on to stay on task in between webinars. And so we'll be putting a document in there as well, just to keep everybody moving forward. And then this will be our next one, which is the provider role in medical management. So since we're here, I'll just go ahead and open this so you guys can see the brochure. And we can talk a little bit more about what's coming up next. I think my next slide says that anyways. So this is a little bit big. Hold on, let me get this smaller. Okay. So our next webinar is going to be May 18th from 2 until 3 p.m. Central Time. We have our registration link right on here. You will need to register and you will need to enter your nursing license number in order to get credit for the CEUs. The other thing is that you will need to be on the webinar the entire time in order to get credit for that. So I just want to reference that before we move forward. If you have questions, let us know. So the webinar is going to be called Heart Failure Provider Role and the Medical Management. So primary care physicians have key roles in the effective management of heart failure. Adherence to best practice guidelines significantly improves patient outcomes. Successfully demonstrating top-notch care while driving quality metrics promotes a competitive advantage in value-based environment. Topics include medical management, guidance on when to refer to cardiology, and treatment options for the advanced heart failure will be presented. So the objectives are that we're really going to be explaining the guidelines on how to prescribe those beta blockers, along with various evidence-based strategies regarding signs, symptoms, and treatment of heart failure. And we'll be discussing dynamic diuretic therapy as well. A little bit about our speaker. You can read his bio, but what I will say about Dr. Alvarez is that he is an amazing cardiologist at the University of Iowa, and he's a clinical assistant professor of medicine and advanced heart failure transplant cardiology specialist there. His credentials are out of this world. He is very knowledgeable and very passionate about heart failure and treatment of heart failure. So we are so happy and so lucky to be able to have him on our next webinar. So that's a little bit about what's coming up next there. As I said, this was healthcare communities, and on the slides it'll give you the pathways as to how to get to everything. And let's get back to our slideshow. So there's how to join your communities, and this slide is how to find your documents. So, and then here is the entire schedule. So as I said, we have the kickoff next week, and then following that will be self-management and resources, June 21st, 12 to 1 p.m. Central Time, palliative care and heart failure, a critical conversation that always succeeds, July 26th from noon until 1 Central Time, and then we'll do our project wrap-up. We'll do that with the Diabetes Initiative as well, August 23rd from 12 until 1. We do have a phase checklist, and oh yeah, I was fancy with this, so I apologize. I'll let Lori explain.
So we have a checklist just to kind of sum up what needs to be done between now and then the first webinar with Dr. Alvarez. And I have this on the slide here. We'll have a nicer one that we'll email out to you when it's ready, that will have links to resources as you go through this. But of course, the first thing is to identify your implementation team. And if you're thinking about still, maybe if we haven't answered your question as to what exactly you'll be implementing, is that we'll be having you proactively working with your heart failure patients, working on an action plan to help them with their self-management. And we'll also be just making sure that as they come in and you're seeing them, that they're getting all the guidelines are being adhered to and they're getting the best treatment possible. Please review that heart failure metric and reach out to us if you have questions about it. Identify what population you will target, so you can choose maybe one doc that would like to participate in this and work with his patients. You can maybe have your health coach if she's seen some heart failure patients. That can be the population. There's just a whole myriad of ways that you can do this. Back to that data. So once you identify the who's and the what's, then develop your process for obtaining the data. So either maybe you are able to pull that from your EHR, and it's a very simple process, but maybe you're going to be doing chart reviews and pulling your data that way. And then brush up on your knowledge of heart failure, and there will be links to the American Heart Association has fantastic resources, and we'll have links to what is an ejection fraction, some of those other things, just in case you don't work with heart failure that often and you just need a little bit of extra, oh yeah, I remember what that is, sort of thing.
All right. Thank you, Lori, for that. So if there are any questions, comments, you want some discussion regarding this metric or the initiative, please reach out to myself, Jennifer Sorensen, or to Lori Galeotto as well, and we will be more than happy to assist, and reach out to your QIAs as well. They're going to be your best resource because they know you the best and know what your clinics are composed of. So just use the resources that you have available, but always reach out to us as well. Thank you so much, and we look forward to seeing everybody at the kickoff webinar.